Cradle cap, also known as seborrheic dermatitis, is a baby condition that causes dry, yellow, flaky patches of skin on your baby's head. The exact cause of cradle cap is unknown, but is thought to be caused by hormones that pass from the mother to baby in the womb, causing too much sebum oil to be produced. A normal skin fungus or yeast may contribute to the cradle cap. Cradle cap usually goes away on its own within a couple months. There are things you can do to help. So, we are going to watch about the how to prevent cradle cap.
Method 1. Using common preventative measures.
First is purchase a mild shampoo safe for your baby. Using a mild baby shampoo is always best for your baby, unless your doctor recommends something different. Pick one that is labeled for babies and says mild or gentle on it. Step 2. Wash your baby's hair once every 2 or 3 days. Up until your baby's umbilical cord falls off, consider just giving him or her sponge baths. Cradle cap is not directly caused by allergies or not bathing your child.
Step 3. Keep your baby's head dry.
Some suspect that sweating can lead to cradle cap. If it's not cold out, try to keep warm hats off your baby.
Step 4. Rub your baby's head every day.
Once a day, massage your baby's head gently with your fingers. You can also use a soft bristled baby brush. The idea is the increase in circulation can decrease the chances of your baby getting cradle cap.
Step 5. Work on the scales.
Once your baby gets cradle cap, one way to help prevent it is to work on the scales. Do not try to peel scales off with a fingernail. Just try to gently loosen any ones that are already coming off.
Finally, use mineral oil or petroleum jelly.
Another way to help loosen scales is to use mineral oil or petroleum jelly. Simply rub a bit on the baby's head and let it soak in. This may take anywhere from a few minutes to a few hours. Method 2. Giving your baby a regular bath or a sponge bath. First is work in a warm room with warm water. The room shouldn't be cold enough that it gives your baby shivers. The water should be comfortably warm, but not too warm. Test it on the inside of your arm to make sure it's comfortable.
Step 2. Make sure you're ready.
For a sponge bath, you'll need a flat surface in a warm area, along with something for your baby to lay on. You'll also need a washcloth, mild soap, mild baby shampoo, and a towel. Don't forget the clean diaper and clean clothes.
Step 3. Stay with your baby at all times.
It is never safe to leave a baby alone in a bathtub or on a flat surface like a counter. It only takes an inch of water to drown a baby, and it can happen in under a minute.
Step 4. Place your baby down.
Make sure you keep your baby warm by pouring water over him or her throughout bath time. If your baby is in a bathtub, if you're doing a sponge bath, place your baby on his or her back on the flat surface.
Step 5. Wash your baby.
Use a mild soap to wash the rest of your baby's body. Start with the face, rinsing it with clean water only. Move on to the scalp. Use a little baby shampoo in your washcloth or hand.
Step 6. Make sure your baby's scalp is clean.
At the end of the bath, make sure you've washed all the soap off the scalp. Leaving soap on can cause dryness, which in turn may contribute to cradle cap.
Finally, dry off your baby.
As you lift your baby out, be sure to have one hand supporting his or her neck. At the end, use a towel to gently pat your baby dry. Make sure the scalp is dry.
We hope it is useful to you. Please subscribe to our channel to upskill yourself.